All right, let's talk about something that causes so much anxiety for new parents, diapering. It feels like a never-ending task, right? And it's filled with so much conflicting advice and a ton of worry. So today, we're going to cut right through all that noise, look at the actual science, and give you the confidence you need to handle diapering completely fearlessly.
The age-old question. This is the one that has probably sparked debates in your family for generations. Do you go with the traditional cloth diapers or the modern disposables? I mean, this one choice causes so much stress, pitting your grandma's advice against modern convenience.
But what if I told you that this entire debate is completely missing the point? What if the material of the diaper isn't even the most important thing when it comes to preventing a nasty diaper rash?
So let's reframe this whole thing. A diaper rash is not a sign that you've done something wrong. It's not a reflection on your parenting. It's a predictable, basic chemical reaction. It's not bad parenting at all. It's literally a chemical burn happening on your baby's super delicate skin.
Okay, so here's the science, and it's actually pretty simple. A baby's skin has this awesome, naturally acidic layer that protects it. But when pee, which has something called urea in it, mixes with bacteria from poop, which has something called ureas, bam, it kicks off a chemical reaction, and that reaction creates ammonia. Ammonia is super alkaline, and it just dissolves that protective skin barrier, which is what causes that painful red rash.
To really get a picture of what's going on, think about this analogy. Imagine your baby's skin is like a piece of delicate silk. Now, a soiled diaper creates this toxic little environment around it. It's warm, it's humid, it's filled with those alkaline chemicals, and there's constant rubbing. This perfectly captures just how incredibly vulnerable their little bottoms are.
Let's just walk through this chain reaction real quick. Step 1. Pee wets the skin. Pretty simple. Step 2. Bacteria from poop gets mixed in. Step 3. That's when the nasty ammonia gets created. And finally, step 4, the skin's protective barrier is gone and you're left with a painful burn. And believe me, this can all happen way faster than you'd think.
So now that we know what causes it, how in the world do we stop this chemical reaction? Well, it's all about following 5 simple science-backed rules. Think of these as the doctor's non-negotiables that work no matter what kind of diaper you decide to use.
First up, and this one's huge, frequency. If you're using disposables, the rule of thumb is to change them every 2 to 3 hours during the day. But, and this is the big but, if you smell poop, you change it right then and there, immediately. Poop is the main culprit for the worst burns. Now for cloth, the timeline is even tighter. You've got to change it within 5 to 10 minutes of every single pee or poop.
Rule number 2 is all about creating a physical shield. You need a good, thick barrier cream, something with zinc oxide or even just plain old petroleum jelly. And the trick here is fantastic. You don't rub it in till it disappears. You apply a thick, visible, white layer, just like you're frosting a cake. If you can still see the pink skin through the cream, you haven't put enough on.
All right, rules 3 and 4 are a team effort, washing and drying. They're both so important. First, the best way to clean is just with plain warm water. Wipes can be okay, but a lot of them have fragrances and alcohols that really sting irritated skin. Next, and this is crucial, always gently pat the skin dry. Never, ever rub. Rubbing just creates more friction and irritation. And finally, the best and cheapest cure for almost any rash is oxygen. Give your baby at least 15 to 20 minutes of totally diaper-free airtime every single day. And rule number 5, the perfect fit. A diaper that's too tight or too loose is a recipe for disaster. It causes friction and leaks. So here are 2 simple checks. First, the 2-finger test. You should be able to slide 2 fingers easily under the waistband. Second, see those little ruffles around the leg holes? Always pull those outward. That's what creates the seal to prevent leaks.
Okay, so now we have our action plan. Let's use this science to tackle some of the most common and honestly fear-inducing myths that are out there. Think of this as arming yourself against all that bad advice you're bound to get.
Let's start with a big one, especially if you have a little boy. You've probably heard this myth that the heat from a disposable diaper can actually damage a boy's testicles and lead to infertility down the road. It causes so much anxiety. Let's be crystal clear. This has been totally globally debunked. Study after study has shown that modern breathable diapers just do not raise the temperature enough to cause any harm to development or fertility. It's a myth, plain and simple. You can let that worry go.
All right, next, the super common practice of using baby powder. The thinking is that it keeps the baby nice and dry and fresh, right?
This advice is passed down from generation to generation. But the reality is, pediatricians all over the world are practically screaming, "Zero powder near a baby's diaper area." Why? Well, two huge reasons. First, when that powder gets wet from urine, it clumps up and basically creates a sandpaper paste that causes awful friction burns. Even worse, the tiny particles get into the air, and if your baby inhales them, it can cause irreversible lung damage. It's just not worth the risk.
Oh, this next myth, it places such a huge and unfair burden on breastfeeding moms. It's the idea that if your baby gets a rash, it's somehow your fault because of something you ate, maybe some spicy food or mangoes or chicken. The reality? Your diet cannot cause a chemical burn on your baby's skin. Period. A rash is either from that chemical reaction we talked about, or sometimes it's a yeast infection. Blaming a mom's diet is totally unscientific, and all it does is create a mountain of unnecessary guilt.
Okay, for all you cloth diaper users out there, here's a myth for you. It's the idea that to get cloth diapers really truly clean and germ-free, you have to wash them with strong antiseptics like Dettol.
But this is actually so dangerous. Those harsh chemicals leave a residue in the fabric, and when that fabric gets warmed up by fresh pee, the chemicals get reactivated and can cause catastrophic chemical burns. The safe and totally effective solution is way simpler. Wash with a mild detergent and then use the most powerful, free disinfectant in the world, direct sunlight. The UV rays are the best sterilizer you can get.
Okay. So you're following all the rules, but what if a rash shows up anyway? Most of the time, some mild redness will clear right up with your action plan. But there are very specific warning signs that mean it's time to stop trying to fix it at home and call your doctor.
Here are the three main things to look out for. First, if the rash is a deep, beefy red color and it has little red dots spreading out from the edges like little satellites, that's likely a yeast infection and needs a prescription cream. Second, if you see any blisters, yellow crusts, or any fluid weeping from the rash, that could be a bacterial infection that needs an antibiotic. And finally, if your baby screams in pain at the slightest touch or has a fever, you need to see a doctor right away.
And let's end on this because it's so important. A day will probably come when you open that diaper and see a red, angry rash. And in that moment, I want you to just take a deep breath. It is not a report card on your parenting. It's not a reflection of your love or your ability as a mom or a dad. It's just chemistry. So the real question was never cloth versus disposable. The real question is, are you blocking the chemical reaction? And now you have the science to do exactly that. You've got this.